Consider this part 2 of the monitor unit equation video. In the previous video we described S sub C, S sub P, and S sub CP, the collimator, phantom, and total scatter factor, and how it changes the dose rate on your machine when you dial up monitor units. Next I want to talk about wedge factors. I know that TMR was next, but I want to talk about if we put something in front of the beam, okay, whether that's a tray or a wedge, what happens. So remember our monitor unit equation. Tray factor, isodose line, inverse square law, and off-axis factor. Some people call it off-axis ratio. So these two are done. S sub C, S sub P, the total scatter factor, S sub CP, TMR we'll go back to. Now I want to talk about wedge factor and tray factor. First of all, tray factor is the easy one. So all a tray factor is it's an attenuation correction factor. We don't really use trays anymore because of the advent of MLCs. We don't use Sarabin blocks. Occasionally, maybe once or twice a year, or depending on your department, you may have to cut a photon block. In fact, as a dosimetrist, I would encourage you, if they still have a block cutting machine, that you try and cut a few photon blocks and have the other physicists or dosimetrists help you out with that, because that would be a nice skill to have to bring to your resume. So if we have a Linac beam, this is a phantom patient surface, and we have a point of measurement, and if I deliver 100 monitor units, I get a specified amount of dose here. For the sake of simplicity, let's just call it 100 centigrade of dose. Okay. Now, if I stick something in front of that beam, a tray, I stick a tray on there because the photon blocks sit on top of the tray, right below the aperture of the collimator assembly. So this tray is made of acrylic. It has some sort of attenuation for it. How does the physicist measure it? He takes a measurement without the tray, and he takes a measurement with the tray. He takes with the tray divided by without the tray, and that gives an attenuation factor. This attenuation factor for 6x photons is normally right around 0.97, 3%. By sticking this little acrylic tray in there, I attenuate that beam 3%. I need to adjust for that. If I deliver 100 monitor units without the tray and deliver 100 centigrade, if I deliver 100 monitor units now with the tray in here, I deliver 97 centigrade. I don't want 97 centigrade. I want 100 centigrade. So what do I have to do? I have to adjust my monitor units that I dial up on the machine. So I take 100 divided by 0.97. That gives me my new monitor units that I dial up. Again, it's an attenuation factor. That's what we're doing when we put the tray factor in here, is we're adjusting the monitor units higher to account for a decrease in output because of the attenuation by the tray. Now, wedges are a similar case. How do we measure a wedge factor? The physicist measures without the wedge and with the wedge, and he divides the two. So the wedge factor is strictly a transmission factor. Okay? It's nothing else. What are your wedges made out of? I encourage you, go on your machines at your clinic sites and go in the room, pick up the wedges, handle them. What's the thickness of the wedges? How much do they weigh? Are they bulky? Are they difficult to put in the machine? How do you put them in the machine? What are the wedges made out of? I mean, what materials are they made out of? Okay? All it is, the wedge factor is a transmission factor and nothing more. Okay? And just like the tray factor, we have to account for the transmission or the attenuation of the beam in that wedge. Okay, so to measure the wedge factor, we'd have the reading with the wedge divided by the reading without the wedge. And that gives us our wedge factor. But the wedge factor will always be less than 1. Always. It has to. Okay? Now, as a dosimetrist, if you forget to put the wedge factor in your monitor unit, you will potentially overdose the patient by a lot, or underdose the patient. I should say If the dosimetrist forgets to put the wedge factor in the patient, we will underdose the patient. If the therapist forgets to put the wedge in the machine, you will overdose the patient. Okay? Well, how does that work? If I have radiation beam coming down, patient surface, this is my point of measurement. Again, to keep the numbers simple, I dial up 100 MU to deliver 100 centigrade. Okay, as a dosimetrist, okay, we put a wedge in this machine. It's made out of metal, and it attenuates the beam. Let's say the wedge factor is 0.5. It attenuates the beam by 50%. Okay, if as a dosimetrist, if you forget to put the wedge factor in the calculation, what's going to happen is you're going to tell the therapist to dial up 100 monitor units. How much are they going to deliver? They're not going to deliver 100 centigrade. Half the beam's been attenuated. They're going to deliver 50 centigrade. Patient's going to be underdosed by half. Huge. Okay. As a dosimetrist doing your second hand calc, you should be plus or minus 5% for normal geometries. You know, the goal for some facilities is less than 2%. You know, the goal of the hand calc is to catch gross errors. Okay, if you forget to do the wedge factor, this is not a gross. This is a misadministration. Patient receives less than half the dose that they wanted to. Okay, so what do? We need to put the wedge factor in the beam. So if I put a wedge in the beam and I want to deliver 100 centigrade, how many monitor units do I dial up if my wedge factor is at 0.0 or 0.5 at 50%? Well, I need to dial up twice as many MU. So I need to deliver 200 MU. Now, from the therapist's standpoint, most modern linear accelerators, you have multiple interlocks that will prevent you from doing this, but you never know. Things have been known to go wrong. So what happens is that from the therapist's standpoint, if you plan it with the wedge, and if they forget to put the wedge in, now they're delivering 200 centigrade with no wedge. They're going to deliver 200 centigrade to the patient instead of 100 centigrade, and they're going to overdose the patient by twice as much. Okay? This is why documentation, communication, and safety checks by the physicist are so important.